There's one more bit of housekeeping that I need to cover before we get on to the physical part, and that is talking more about stiffness that people with a neurodegenerative disorder have in their posture. Sometimes it's not all what we create by our reaction. Sometimes it's caused directly by the disorder. So there are two major components to the stiffness we have with these neurodegenerative disorders, and it's the psychological stiffness or the reactionary stiffness. We develop that in our posture in reaction to what's going on with our disorder that makes us clumsy, and then it presses on, as we've talked about before. So there's that psychological component, and that's a fear-related component. Indirect effects, maladaptive behavior, all rolled up into one, as we've talked about. Now, the other major component of the tightening of the muscle, the guarding and the stiffening of the muscle, is a physiological cause. And that is the disorder itself is doing something to change our system on the inside. It changes the tone of our muscles. It makes them a little bit more constricted than what a relaxed muscle normally is. So this varies with different people. Some have it a little bit, some have it not at all. And then others have it once in a while. It's kind of temporary, kind of comes and goes. And then there are some very unfortunate people that have a great deal of this physiological stiffening that just makes them very tight. They can't move very well because their muscles are more constricted than they should be. And for those people, about the only thing that can be done is giving them a medication that helps relax those muscles. Some of them get good benefit from that, some don't, and there's a lot of in between, but at least it's something for them. Now, I've worked with a few people that have a good amount of that physiological permanent stiffening, and they are on those drugs, and working with them with how to relax their posture a little bit, how to be more stable in their feet, they were able to let go of a little bit more of that, but not very much, because of the direct effect of the disorder changing the nature of those muscles. Now, that's the worst part of the physiological stiffening. Now, there are a couple other varieties that are temporary in nature. Some of us stiffen up fairly quickly to cooler temperatures. Once we start to warm up, that stiffness starts to resolve, tends to go away, but it takes a little bit longer than the average person would be if they get stiffened from the same type of thing. So with that neurodegenerative disorder, the cold and the coolness makes the stiffness come a little bit quicker and last a little bit longer, and it takes longer to get rid of. The other part is, some of us with these neurodegenerative disorders, when we sit too long or stand in place too long, we also get stiffened. And there again, that takes a little bit of time to get rid of. It takes being very careful what you do before you stand up, as you stand up, and when you're standing before you start to move, to relax some of that so you're able to move without falling. It can be fairly significant, and it just takes being careful to learn how to deal with it. So what do you do to avoid stiffening up like that, well, you try not to sit in one place for too long. You try not to stand in one place for too long. You sit and stand. You do things to keep yourself as loose as you can. When it's cooler or in cold weather, when you know you're going to be out in it, you dress a little bit warmer. You know, it's like living up north. You know how you have to dress in layers. So when you start to warm up, you can take layers off to suit the warmth of the day or the coolness of the room or whatever it happens to be. So there's some precautionary things that we can do to help ourselves not be quite as bad with that. But there again, some of it we just can't avoid. It'd be like going to a restaurant and the air conditioning is down a little bit too low. When we get up, a lot of us are stiff, and it takes walking out with just some baby steps and being very careful until we get warmed up and loosened up enough to be able to take some more natural stride. So, psychological stiffening from the fear component of the indirect maladaptive behaviors that we do, and the physiological stiffening as we just talked about. Physiological stiffening has nothing to do with the psychological stiffening. The physiological stiffening is a direct effect of the disorder. The psychological stiffening, that is an indirect effect of the disorder, maladaptive. So the psychological component of the stiffness and the guarding, we can learn to deal with that, make it less. The physiological stiffening, a direct effect of this disorder, some we can do a little bit about, some we can't do anything about. But all things considered, we have these things happening to our body because of this neurodegenerative disorder that we have. And regardless of what it is we have to deal with because of it, we truly have to learn how to do a little bit better with everything that we have going on to be able to live our life a little bit better. To be as best as we can with our movements and not get so bogged down with all the bad stuff. It's there. You just need to learn how to deal with it. So it's not such a big deal. We need to move into feeling what we actually feel. Feeling for our stability. Feeling for what's actually happening and how to control that to make ourselves more stable, better balanced, less clumsy, the whole shebang. So let's go.